Good afternoon, everyone, and thanks for joining us for the latest edition of Valley Children's virtual health series. I'm Zara Arboleta, joined today by Dr. Karen Dahl. Dr. Dahl, good afternoon.
Hi, Zara. I'm really excited to be here and talk about this vaccine now approved for adolescents.
Yes, and so that's what we are talking about today, COVID-19, and an update on vaccines. Just last week, it was approved for emergency use, the Pfizer vaccine for children 12 to 15. So they lowered the age from 16 down to 12. Dr. Dahl is an expert in all things infectious diseases. She is a pediatric infectious disease specialist. She is also a vice president at Valley Children's, and she's the VP of Quality, Patient Safety, and Medical Affairs. All right, so Dr. Dahl, I think the number one question every parent has right now is, should I give my child the COVID-19 vaccine?
Yes,
who's 12? Who's at least 12 years old?
I absolutely believe you should. And I think the data that was presented and the experience we've had since the introduction of the Pfizer vaccine, with over 140 million people being vaccinated, has really given us great reassurance about the safety and the effectiveness of this vaccine. In addition, the data that was presented to the FDA and then reviewed by the Advisory Committee on Immunization Practices strongly supports the safety and effectiveness in this age group.
So for those of you watching on Facebook, please feel free to leave comments or additional questions in the comment section, and we'll get to all of them. We have been soliciting questions via social media for the last week or so. And as you can imagine, Dr. Dahl, they do fall in very similar buckets. So one was, should my child get the vaccine if they're at least 12 years old? Your answer was a definitive yes. And then there are more questions that came in. One of them is, were there any adverse events or severe side effects during the study when it did come to adolescents?
So in adolescents, about 1,000 adolescents in this age group received the vaccine during the clinical trial, and there were about 1,000 adolescents in the placebo arm of this trial. Adverse events occurred, but were very uncommon, and almost all the adverse events that were reported during the study period were things that were expected as side effects of the vaccination. The other one that's not necessarily a common side effect, but was seen in the adult population, is that you can get swollen lymph nodes. So that was reported as an adverse event in children 12 to 15 as well. Less than 1% of kids swollen lymph nodes on the same side of the body that the vaccine was given in, and typically in the neck area and then under the arm.
Okay, along those same lines, one person asks, how do we know the long-term effects if this vaccine has not been studied for a very long time, especially for this younger age group?
So we have decades and decades of experience with vaccinating children and infants. And we now have a great deal of experience, 140 million doses of Pfizer vaccine given to people in the United States, and excellent follow-up on that with some new surveillance techniques that really did pick up on rare things that were not seen in the trial, such as the anaphylaxis. So I think the safety that's in place for this vaccine is excellent. And although the follow-up time has not been long for children, it's been longer for adults now that it's been in use longer, and we haven't seen anything unexpected. And I would just parallel this with our usual vaccines that we give to children. We don't wait for years of data before we introduce a vaccine that we believe to be life-saving and effective.
Mm-hmm. I know in recent memory, parents have had to start giving the chickenpox vaccine, HPV, those types of things. And I don't remember when those went into effect quite so much chatter about their safety and efficacy. Do you think because it's COVID-19 that it's just naturally lent itself to a bit more speculation, rumors surrounding it? It just seems so different, the launch of this vaccine as opposed to some other ones that were for children too.
Well, I think the difference here is that we have not, in my career, had emergency use authorization instead of full authorization by the FDA rolled out to the general public. So that is different about this vaccine. And there was extra safety monitoring put into place after the rollout of the vaccine, specifically to help address that, because we knew we would be vaccinating large numbers of the population and really needed to capture anything that wasn't found in the clinical trials. So I think this has been such a large number of people vaccinated. We really have a great idea of what the actual side effects could be.
Another parent asks, are kids, and you touched on this a bit, but are kids experiencing similar side effects as adults? I know you mentioned that the lymph nodes were a little bit different, but what about some of the other side effects that adults have been experiencing with the Pfizer vaccine since administration began in December?
So it's a little bit of a different story. There's similar side effects, and I can go through those. And I'm not going to lie to anybody. It's more likely than not that your child will have a side effect from this vaccine. About 90% of children will have a local side effect, meaning at the site where they get the injection, they're quite likely to have pain and possibly some redness and some swelling. The pain has been reported as mild to moderate, so not interfering with activities, and resolves in a day or two. The pain at the injection site tends to be worse with the first shot than the second shot. Now, when we look at what we call systemic or sort of whole body side effects that can occur after the vaccine, as was seen in adults, those tend to be more pronounced after your second dose. And among children in this age group, the side effects were really similar to those in the nearest age cohort, the 16 to 25-year-olds that had already been studied. And the most common side effects are headache and fatigue. Now, the other side effects that we've seen in adults can still occur, such as fever. About 20% of the kids after their second dose did have a fever, and that was not a very high percentage. Again, the fatigue and the headaches, much more common. Joint pain still possible, muscle pain possible, chills. Those would be the most common side effects reported in adolescents.
So is that a higher percentage, lower, about the same as people maybe in their 20s or 30s have been getting, or is it?
So there's a bunch of different age ranges they break it down to. So this was compared specifically to the 16 to 25-year-olds and is almost the same. Very similar. Now, as you may recall from when we've talked previously, the older adults had very few side effects. So it's certainly more common than in older people. And any one person has their own individual reaction, and you may or may not have what's most common in your age group. I would say that, like we would recommend for adults, we don't want you to take a medication to prevent the side effect, but it's absolutely okay if you have a headache after the vaccine, if you have a fever, to take a medicine for that, such as a non-steroidal anti-inflammatory like Advil, ibuprofen brands, or acetaminophen. So those would be fine to take to treat those symptoms if they occur.
Okay, and then we did get some questions in. What about younger kids, including infants? When is the projected timeline to start lowering the age for that EUA to administer Pfizer or maybe even Moderna at some point to younger groups, even younger groups?
So it's a really good question, and I hesitate to answer because I don't have a crystal ball. But I do know that studies are ongoing with both Moderna and Pfizer for the younger age groups. And I would expect the next age group that we would see an indication for would be the 6 to 11-year-olds. So I would expect that group of kids to be next in line. And I would be hopeful that by the end of the summer, beginning of the fall, we would have data submitted for that and an application for FDA authorization. And the plan is to continue to study children in younger age groups. So they're doing it stepwise and looking at safety and reactogenicity and the side effects of the vaccine. So after they do 6 to 11, if all goes well, they'll continue down to the infant group.
Okay, and that leads to the next question. This came from several parents. I'm kind of lumping it all into one, but one question we saw a lot was, what is the reasoning behind vaccinating healthy children who seem to be at low risk for COVID-19 or really don't have a severe reaction to the virus in the first place, especially if adults around them are vaccinated and aren't at risk post-vaccination?
So that is a really good question. And I think the epidemiology of COVID is changing. And now that there are a lot of adults who are vaccinated, kids are accounting for more of a proportion of cases that we see. And I would say it's not uncommon for kids to get COVID infection. It's uncommon for kids to be hospitalized or for children to die, but it is not at all uncommon for the adolescents to have symptomatic disease from COVID. So they're definitely getting the disease and they're getting symptoms. Their hospitalization rate for adolescents is actually higher than it is or than it was during the 2009, 2010 H1N1 influenza pandemic. So if we recall that as being a very bad year for children, COVID is worse than that for this age group. So it is actually higher. Now the recommendation is that all children be immunized against influenza every year. We take that seriously. And this is a more serious disease with more hospitalizations than influenza. I'll also mention that the American Academy of Pediatrics endorsed this recommendation and recommends that all children who are eligible receive the COVID vaccine. One other pediatric specific complication of COVID has been that multi-system inflammatory syndrome in children, which occurs at the end of or following a COVID infection. And that infection doesn't have to be a severe one, and it could be completely symptom-free. And that's a really serious inflammatory condition that often requires hospitalization and even ICU level care. So we really want to protect children from that serious complication of COVID.
And the other thing too, we saw in the news recently, more studies were coming out that people who are vaccinated, it's also less likely they will spread the disease. So also there is that benefit of vaccinating your children. I remember last year, there was even another study that said one of the biggest spreaders of COVID-19 were COVID positive children between the ages of 10 and 19. So do you want to speak a bit to also that angle too, that it's also still protecting others around them as well?
It is, and it will depend again on your individual circumstances in your household and your family. If you, for instance, have an immunocompromised person in your household, say someone who's receiving treatment for cancer, even though they've been vaccinated, we don't believe that the vaccine works as well in immunocompromised persons. And so vaccinating those around them is really important. Another really good reason to vaccinate your child is it helps them get back to the activities and the life that they enjoy. It's going to speed reopening of our schools and in-person sports events and attendance at sports events and gathering with their friends. It's going to make all those parts of pre-pandemic life much more safe once you're vaccinated.
That's a great point. I've got a 7th grader who's in online school in the hallway down there, but my 6th grader is back in school full time. And yeah, you're right. I mean, if this is a very good step toward whatever normal looks like nowadays, but getting back to that. Now, when it does come to, there were a few other questions. What if everybody else in the house is vaccinated? Should a parent still get their 12, 13, 14-year-old vaccinated, even though everybody else is?
I would definitely recommend it because I believe that child deserves the safety of this vaccine and the protection this vaccine offers them. They could still get COVID. They may not need to be hospitalized, but they might need to be hospitalized. And even if they aren't, they're not going to feel good when they have COVID. If you have symptoms, people have been sick from that. We also don't know the long-term consequences of COVID infection. There's a lot of data accumulating on what is called, for lack of a better term right now, long haulers, people who have symptoms that persist weeks and months after their infection has cleared. So I definitely think kids deserve the protection of this vaccine.
For those of you who are watching right now, a reminder, Pfizer requires 2 doses spaced at least 3 weeks apart. We did have a couple of questions coming in. Dr. Dahl, has it been determined whether my child will need a booster, or would COVID-19 vaccines be annual like the flu shot?
So it's absolutely correct that it hasn't been determined yet. Data is still being analyzed, and the public health authorities and the scientific experts are looking at that. And while they're looking at it, the companies that make the vaccine are preparing in case we do need a booster, either because the vaccine may wear off after time or because of the emergence of variants in the community and how that may play a role with vaccination. So the companies are already designing boosters to account for it if we were to need them. But so far, we don't have enough data to tell us.
Lots of questions from parents of our own patients who are asking, can medically compromised children get this vaccine? We had one parent saying they have a 12-year-old with spina bifida. We had another parent saying their child has asthma and food allergies. So I know that we can't get into the nitty-gritty for every individual. My child has this, should he or she get the vaccine? So I think someone asked a very good question. If my child is medically compromised or has a medical condition, what kind of questions should I ask my doctor?
Okay, so I would say there are no medical conditions that are a contraindication to vaccination. So there is nothing that takes it off the table. And something to know about medically complex children and COVID is that those children who get COVID and require hospitalization are more likely to be those children with another medical condition or multiple underlying medical conditions. So I'd say that's a very important group of children to get a vaccination for. In terms of individual conditions, if you have some really specific question about something your child sees a specialist for, I would talk to that specialist and see if they have any recommendations on either the timing of the vaccine, maybe based on some of their other medications that they may get on a monthly basis, or even based on the availability of very quickly accessible medical advice, right? So if you're concerned about your child and their reaction to the vaccine potentially, I wouldn't get that vaccine on a Friday. I would maybe think about getting that vaccine on Monday or Tuesday, where you know office hours are regular and you're going to be able to contact those specialists by phone in case your child has a reaction that you want to discuss with somebody.
Okay, because someone did just write on Facebook, what about children with a history of allergies with anaphylaxis?
So that's an excellent question, and the recommendations are the same as they are for the adults that have been receiving the vaccine, that the only contraindication to the vaccine is a known allergic reaction, anaphylactic reaction to a component of the vaccine. However, if your child has had a serious allergic reaction, such as anaphylaxis, to an injectable medication or another vaccine, that's going to be a precaution for it, for the administration of this vaccine. And that means that at the vaccine site, they'll be observed for longer than the standard 15 minutes. It'll be a 30-minute observation time for those children. Now, the question of food allergies and environmental allergies, those are not at all a contraindication or a precaution for the vaccine.
Okay, so like you were saying, even with ones who've had a history of severe reactions, that still doesn't mean they can't get the vaccine. Just the vaccine clinic staff just watch them longer, so they should still come in.
Correct. Okay. Absolutely.
Here's an interesting one. Someone writes, I'm a special education teacher. A lot of my students are very small for their age. So if they're 12 years old, 13 years old, but they're the size of a 6-year-old, 7-year-old, can they safely get the vaccine?
Yes, they can safely get the vaccine. The immune response was studied in this group, and it's a strong immune response. So in a subset of the 1,000 children who got the vaccine, they monitored blood parameters and compared that to older people who are larger and bigger. And the response was excellent. It was actually a little bit better, but in no way were the side effects worse. So I think it's very safe and effective for even a small 12-year-old to get this vaccine. And if your child is medically complex, and that is why they're small, then it's really important for them to get the vaccine because they're at higher risk for hospitalization if they were to get infection.
I mean, you and I have had several discussions, not only just in other Facebook Lives that we've done, but even personally, I've asked you, because for me, as soon as I could qualify for the vaccine, I signed up. But when it came to my 12 and 13-year-old, 11, and so she's not ready yet, but my 13-year-old, I had clear, it's interesting because here I am, I believe the science, I believe anything you tell me, but there was the mom part of me that was like, I'm so nervous. And I did talk to my pediatrician and she said, one of your kids is bigger than you. So I think you'll be okay. But what do you want to say to parents like me who, for ourselves, we were all in, but for some reason, I'm not saying that it's logical, but for some reason, we're so nervous when it comes to getting the vaccine for our kids.
Well, I think it maybe is the mark of a good parent that you're having like,
Thanks,
should
Dr.
I do
Dahl.
this? You should have the question in your mind because you're making decisions for another human being. And that's the awesome responsibility that parents have every day about so many decisions. So I think it's a completely natural reaction. And you should ask that question. And then you should go to some reputable source for your information that you trust, whether it's Valley Children's, whether it's your own primary care physician or provider, whether it's one of your specialists, getting that advice from someone you trust. Because I would say the CDC and the Advisory Committee on Immunization Practices is a little bit of a faceless identity for us to just have trust in. I think it was really reassuring for me, and I was very excited that the American Academy of Pediatrics recommends this vaccine for children. They're great advocates specifically for children. And so that, for me as a physician, was really important to hear. And again, the safety of the vaccine is excellent. The effectiveness is excellent. And if you have more questions, right, we're available for questions here. Even if we don't get to them during live, we can chat about them. But talking to your trusted provider may give you the reassurance you need to move forward.
Well, for the record, my pediatrician and you are the reputable sources for my family. So thanks for always being willing to answer my questions for this. And I'm sure our viewers at home appreciate it too. Another parent just wrote in on Facebook, how do we keep our younger kids safe until there is a vaccine for younger than 12, especially with everything opening up, at least here in California, June 15th. And now no one really, fewer people will be out there wearing masks?
That's a great question. And it makes all of us wish we had the vaccine sooner for the younger children as well.
That's true.
But I think what you can do is what you've been doing throughout the pandemic to keep your family safe. Even if a mask isn't required when you're going somewhere and you have an unvaccinated child, and they're over 2 and they can tolerate a mask, they absolutely should be wearing that mask. So masking indoors, really important. Taking those unvaccinated children to large events where people may or may not be vaccinated and congregating closely is probably something I would not recommend while they're unvaccinated. Protecting them as much as you can by vaccinating that bubble of people around them. So if you have adults and children eligible for the vaccine in your household, making sure everybody who's eligible is vaccinated then helps protect that younger child who's not yet eligible. So I think despite what the rule may be at the store you go to or what it may be state by state, keeping the younger children masked when they're indoors and really avoiding large crowds of people for them would be a way to keep them safe.
Okay. Someone else asks, my son had COVID and pneumonia back in January. Is it okay if he gets the vaccine?
So I'm sorry your son was one of the children
Yeah.
who did get COVID and get sick, and I hope he's recovered completely. Having had an infection with COVID, it is still important to get the vaccine. So I would recommend that that child still get the COVID vaccine. And the question of timing is when you're recovered from your COVID illness and you're at least 10 days out from the onset of your illness or a positive test result if you weren't ill, but just had a test that was positive, is the time that it's safe for you to go get the vaccine and not expose other people to COVID. But as soon as you're recovered, that would be the time to get the vaccine. Now, there's a slight nuance to that. If you had a child who had MISC or multi-system inflammatory condition as a complication of COVID, those children are recommended to wait 90 days after the onset of their MISC to receive the vaccine.
Okay, so in both cases, not only a positive COVID-19 diagnosis, but also MISC, you're saying it's still safe for them to get the vaccine. They just might have to wait a little bit before doing so.
Yes, absolutely. Okay. It's safe and it's a good idea.
Okay, we did have quite a few issues or questions coming in regarding the potential, potential effects on reproductive issues for kids later in life. And then we had 3 different questions come in right now on Facebook about teenage girls, menstrual cycles. Does the Pfizer vaccine in any way, shape, or form affect menstruation or reproduction later on in life?
So I'll go to the menstruation question first. If you have pretty significant side effects and you haven't yet had very regular cycles, then I think that the vaccine could alter your pattern a little bit in the very short term, as any significant event could. Especially some young girls haven't had a really regular cycle yet, so it's a little bit harder to pinpoint how that might affect it, but it would not be a long-term effect. Now, the question about reproductive health has come up not only for children, but for especially women who are younger have had a lot of concerns for that. And there has not been any concerns in the clinical trials or although they haven't gone on for a long time, there's no biologic plausibility argument, no reason that this vaccine should cause that side effect. And the American Society of Reproductive Medicine and also the Obstetrician and Gynecology Society do not feel there's any risk and that people should be vaccinated without concern for that.
Okay. Someone else writes, my concern with this vaccine is it's the mRNA mechanism, which, it's also, Moderna is also mRNA, Pfizer is not. Do you want to speak maybe real quickly for people who don't understand what this technology is? What does it mean that these are mRNA? That's a technology used for these vaccines.
So it's a great question, and I can see why people are concerned about it, because all of a sudden we had COVID-19 vaccine, and it was a brand new kind of vaccine that nobody essentially had heard of. I mean, a few people in the medical community and research communities knew about these vaccines because they had been studied previously and very small trials and then put into practice in other countries using vaccines with mRNA technology, specifically for Ebola virus. So mRNA is not the genetic code, but it's the messenger of the genetic code. And it's the messenger for the genetic code of the spike protein of coronavirus, which is what your body recognizes as foreign and mounts an immune response to. That mRNA is not very stable at all, which is why these vaccines are stored at such low temperatures. And the mRNA is protected in a little bit of a fat blob when it's injected, and then it gets taken up by your cell. And as soon as the code is released into the cell, or the message for the code is released into the cell, and your cell starts to make those proteins for the body to recognize, the mRNA portion of the vaccine is degraded very quickly and does not stay in your body, doesn't enter the nucleus of the cell where your DNA is, doesn't interact with it in any way like that. So it is a very new technology to most of us, and it's the first vaccine licensed for large-scale use in the US with mRNA technology. So certainly is a new form of vaccine. The advantage for this vaccine, especially during the pandemic, is it's easily, rapidly produced in large numbers. We're not waiting on things to grow in egg culture like we do for influenza vaccine, and then we're limited by the number of eggs we have that year we can buy commercially, and it takes time to grow things. So we're not constrained by those time limits. So it was a really great technology to be used in this time is of the essence pandemic. Sarah, I think you're on mute.
Thanks for that. Yeah, there's a gardener about 2 houses down, so I feel worried that it's coming through. Someone else writes, I saw an April report about MIS-C rates in California, stating that there were about 300 cases statewide, 100 in the Valley. And we've had other forums where we've talked about MIS-C, and that it does seem to disproportionately affect people in the Valley, but the numbers might be skewed a little bit. So this parent's asking, do you know why that might be, that it seems like more kids here are getting MIS-C than other parts of the state?
So I think it's too early to know for sure if it's true that there's something about the conditions in the Valley that make it more common here. That's certainly possible, or the underlying medical conditions of children in the Valley. We have a lot of asthma, we have a higher rate of obesity, whether those are factors that play into it, or is it a problem with reporting? So the report is really a big burden on the hospitals to give that information to the state. So there may be a lag on that. And I know we've placed a really, really high level of importance here at Valley Children's on reporting that accurately and quickly as we can. Mm-hmm. So I think we've been really committed to our reporting, and we've committed our resources to doing that. But I would understand why it may not be reported as quickly in some other areas, especially if there are adult hospitals who were hit harder by the clinical load of COVID patients in adults. It may not have been their priority to report. So I think the numbers will catch up over time. We'll see, is it really something about conditions in the Valley and maybe health conditions here, or environmental factors, or is it a reporting difficulty?
I remember we did an MIS-C forum with the Fresno County Department of Public Health, and someone had asked at that forum, how come it seems like Valley Children's was reporting so many? And some of our other specialists were saying, you got to remember too, Valley Children's is the only children's hospital between Bakersfield up to southern Sacramento. So we have a very wide area as opposed to a hospital in LA. Geographically, they have that one little area that they're covering. And so I remember the doctors that one saying, you know, I don't think anyone needs to panic. You just have to understand the demographics of where we are too. Because there were a lot of really worried people, like, how come Valley Children's is seeing so many of these? Well, we also see so many kids, period. And so I remember them talking about that. Someone else asks, I've read that adults with Down syndrome, this is more a comment for you, this parent wanted to share. I've read that adults with Down syndrome have a 10% mortality rate if they get COVID. My 8-year-old has Down syndrome. I'm very scared for her, but I cannot wait for the vaccine to be available for her. So that's a mom who just wanted to share that with you, Dr. Dahl.
And that definitely was what we were seeing early on, the reports of adults who had serious complications and higher death rate with the Down syndrome. So I share her concern, and I hope, sounds like she's probably one of those moms who's already doing everything possible to keep her child safe, and we'll keep hoping for that vaccine for that age group to come out as quickly as possible.
What about, I know that you had talked about earlier, if your child has a medical condition, to really talk to their specialist to help them answer your questions and ease your fears. But there were a couple of questions who came in about, what about children undergoing cancer treatment? Is it safe to get the vaccine while they're in chemo, or should they wait until treatment is over?
So I think that, again, is something to discuss with their oncologist. And if you're undergoing treatment for cancer, you're seeing your oncologist pretty frequently. We don't have any reason to believe it's not safe. We believe it's very safe in that group of patients. What we don't know is how effective the vaccine is, because we're counting on your body's immune response to give you protection from this, and your immune response is compromised during cancer treatment. So there are ongoing studies for people being treated for cancer and getting the vaccine. So those studies are ongoing, and we should have more information. It's not a safety question of should they get it, is it safe for them? We're not sure how effective it will be, but it's not a contraindication.
Okay, and that goes along the lines of another question that we were talking about even before this, that one parent had asked last week. What are the recommendations for teens with autoimmune diseases, or if they are taking immunosuppressants for those diseases?
Yep, it's very similar to that. So there aren't any conditions that we would say, no, your child should not be vaccinated because of this. And if your child has a really rare disease and is getting a very unusual treatment, your specialist can actually contact the CDC. There's a special branch of the CDC that if your child doesn't, or your person doesn't fall under the general guidelines and you need some more specific information, your physician can contact the CDC and the experts there and tell them about your particular medical circumstances and what would be recommended based on what is known. But in general, people who are immunosuppressed, if you're taking a medication every day, the timing of the vaccine is not as important, but some immunosuppressive medications are given once a month or every couple of months. And then the timing of when is ideal to get the vaccine should be discussed with the person who prescribes that, so they could help design the best time for your body to make the best immune response to the vaccine.
A couple questions came in along the same lines. Can this affect the nervous system even in the slightest?
So the nervous system is really broad. So I would say, yes, it can affect the nervous system. And what do I mean by that? I would say headache is one of the common side effects, and that's part of your nervous system. There are also, could it affect someone more significantly who has anxiety or depression? That wasn't seen, but it's not any different than in those who had anxiety and depression and got the placebo, a worsening of their underlying nervous system condition. So it doesn't seem to be an issue, but I can't say it doesn't affect it at all, right? Because headache, that's definitely a side effect that we know is going to happen, and that is related to your nervous system. There aren't a lot of other nervous system complications that are coming to mind for me that I would be concerned about.
Okay, and a reminder for people who are watching this, this will be posted in its entirety later. So in case you missed the first part of this, you can watch it later, because we're getting lots of questions like, do you know when it'll be available for 10-year-olds? Do you know when my 6-year-old will be able to get the vaccine? And for those of you who are just tuning in, Dr. Dahl did mention that those studies are happening now, and she is fully expecting the numbers to lower, but she doesn't have a crystal ball, so you're not sure when that might happen, but you are expecting it to be available to younger groups again, eventually.
Eventually, I would say for the next set of children, which will probably be the 6 to 11-year-olds, I definitely expect it sometime this year. If I'm really feeling optimistic, I would say end of the summer, beginning of the school year, but I'm relatively certain that it'll come by the end of the year.
Okay. So this is another specific question, but it's a little different. So if you want to defer to this child specialist, then we can do that. But someone did just come on our Facebook page and say, I have kids with neurofibromatosis, and they also have no myelin sheath covering their nerves. Could it have a bigger effect on them potentially than what might be expected in other children?
I don't think it would, because I don't think, again, the most common nervous system side effect we see is headache. And so I don't think that would be affected much more by this. And then in terms of motor and sensation, I don't that's not a big side effect that we see in groups of people that I would expect to be impacted specifically for these children with this type of myelin problem.
Okay, this is for you, a comment for you. Someone says, hello, I'm listening from Health Plan of San Joaquin. This is so helpful. Thank you, Dr. Dahl.
I am so happy you're finding it helpful. And as I've said for months now, I am happy at any time to talk about vaccine, one of my favorite topics.
So, okay, here's a question too that just came in. Can a vaccinated adult or child give COVID to an unvaccinated child?
So that's an interesting question. And I think the CDC has still not come out and said for sure that vaccine protects against that. So we think that most people who have been vaccinated, it looks like they're not going to transmit any COVID virus to other people, but we don't know that for sure. The data is still is still accumulating. And so again, no one said for sure, but I will say it actually is possible because we know the vaccine effectiveness in adults, at least, is not 100%, right? They said it was 95% effective. And so there are going to be some people who have breakthrough infections post-vaccination. And happily, those infections tend to be mild infections and less likely to be ones that would result in hospitalization. The number of viral particles that person has circulating is probably less than an unvaccinated person would have. And their symptoms are less. So I think there's less coughing, which would definitely spread infection. But I don't think I can say that 100% you can't transmit it to somebody if you've been vaccinated.
Okay. Someone just asked, after I get the COVID-19 vaccine, should I be exercising?
I think it depends on how you feel. So I felt really good after mine. I was one of those people who was pretty lucky and didn't have any side effects for a couple of days. And so I worked out the next morning like I normally would. If you are one of the people who, which is pretty common, feel really wiped out and fatigued, maybe give yourself a break, take the day off. So I think it's going to just depend individually on how you feel. If you feel good, go ahead and exercise.
Okay, so listen to your body.
Yes.
But if you feel okay, you can't use it as an excuse. Oh, I got my vaccine, I'm not going to work out today. Okay, that sounds good. I was one of those who I felt fine after the first shot, but after the second one, I was in bed for about 24 hours, and then I woke up the second day fine. It was pretty interesting because my kids were yelling at me because I got the chills, and so I kept turning up the heater, and they're like, "Mommy, it's so hot in the house." But it didn't. You know, I tell people all the time who are nervous, I'm like, it literally went away pretty much as quickly as it started. And I feel much better now. Let's see. People are asking, will Valley Children's be giving the vaccine to teenagers?
Yes, we are. And I believe, and Zara, you probably know as well as I do, I think we're having our first adolescent clinic today. So kids who are 12 to 15 could be vaccinated today at Valley Children's in the sign up through MyChart, which is how we now sign up for vaccine at Valley Children's Hospital. So we are giving it, and any day that we're doing a Pfizer clinic will be a day that will be open to children 12 to 15.
Yeah, and so just to give people at home who are asking a little bit of information, Valley Children's has turned over all management and scheduling of the COVID-19 vaccine to the state through the website called MyChart, and you can reach it. Just do a Google search for MyChart California, but the URL is mychart.ca.gov. If you put in there that it is for someone younger than 18, then a parent or guardian can fill out that form, and then it will give you a list of locations. So if there is availability at Valley Children's, you can choose Valley Children's at a location. Dr. Dahl, there are a lot of people who are saying, well, you know, you take care of my kid, I would like my child to get the vaccine at Valley Children's. But if our clinic is full, there are also other, I was helping somebody today, and another mom who couldn't get in because we were full already for today's clinic. Our partners at Community Regional, at Kaiser, at some of the other hospitals were also administering the vaccine. So Dr. Dahl, how do you feel for those parents who, they want their child to get it at Valley Children's, but if it's full, do you think it's okay for them to go somewhere else to get their Pfizer vaccine?
I do, because there aren't immediate complications of this vaccine, and there are medical professionals there who are well equipped to handle anything that might come up. Now, I understand why people may have a preference for going somewhere they're familiar with. Mm-hmm. And I would say, if it's the difference between coming on a Monday or coming on a Friday, yeah, you might want to wait. But if it's, oh, I can't get into Valley Children's before I take my child on vacation somewhere, I would say go elsewhere. It's more important to get your vaccine before you go.
And then someone was asking, once children start receiving their COVID vaccinations, will parents be able to access those vaccination records via MyChart as we do all of the other vaccinations?
So Zara, that's a question that I don't have the answer for. I know that the vaccine will be in the California Immunization Registry, or CARE. So it's definitely recorded there.
So actually, I can answer this one because we have another member of our team who's working behind the scenes, who's working on the MyChart system. So for those of you parents watching right now, please go to valleychildrens.org/MyChart and sign up your child for our patient portal. And so yes, if you do receive the vaccine at Valley Children's, it will be fed into your child's MyChart account, and you can see it. It takes just minutes to sign up for your patient portal account. So yes, I was told if you do get the vaccine, it will be reflected in the MyChart records. So there you go. Thanks to Serene, who answered that question for me behind the scenes. Okay, I think we got to everybody's questions. Wow, we had a lot of great questions coming in. I think one more time though, Dr. Dahl, I would love to have you answer this, the concerns that some parents have, especially those who might just be watching now and miss the beginning. Do you feel that the studies involving children were thorough enough to say, yes, it's okay to get the vaccine for children, for 12 to 15 now?
So I strongly believe that the answer to that is yes. The data is there. The studies were solid, the review was thorough, and we knew more going into this study and evaluating the results of the study than we knew when it was approved for adults. So looking specifically for things that had come up uncommonly in adults were looked for very specifically in the pediatric study. For instance, the lymph node swelling, which was not part of the report for adults when it first came out, and those reports were sort of the post-authorization side effects that were reported through the active surveillance that's being done, which is really, really important. So then they looked and asked for that specifically in children. So we have more information going into our studies for children, which is really important. I would say this is also a good time for me to make my plea for VSafe. When you sign up your child for vaccination and you're there for your 15-minute observation period, please enroll in VSafe. That's on your phone, and it's a web-based smartphone app to help the CDC monitor for side effects that we may not know about, and also to investigate anything that may be a serious complication from the vaccination in your child. You'll get an email alert or a message alert once a day for the first week, and then it spaces out after that, and it goes to once a month and once every couple of months. And it's so important for the long-term monitoring for these newer vaccines, especially when we're vaccinating such a large population. And it's been really helpful in finding out if there are any rare or unexpected side effects.
Thanks for that reminder. It literally takes seconds to fill out a VSafe questionnaire. I got one the other day. I think it's the first time I got one, and I can't even tell you how long. I was like, oh, look, the CDC's checking in on me. And it does take just seconds. One more thing, someone sent a direct message. What do you want to say to parents who have fears, but they do decide to get their children the vaccine, and they're dealing with on social media? It can sometimes be a very ugly place. So what do you want to say to parents who might have to battle people who are spreading misinformation about vaccines out there? I think these are probably parents who are, sometimes Facebook isn't the prettiest, most fun, cordial place to be. So yeah, any advice for parents who decide to go this route and might have to worry about now justifying it because people are sending them links to flat out wrong information?
I don't think this is different than other things you do for your children that people may have different opinions on. And this is their personal medical information, and you're not obligated to share it on social media. And if you feel uncomfortable about it, or you know that you're in a circle of people who may have different opinions than you do about it, I wouldn't make it a focal point of conversation. If it's a safe space to talk to people about it, then I think that's fine. But again, no one's really obligated to know this information about what you choose to do for your child and the reasons you have for doing it. So don't feel like you have to wear a t-shirt that says my kid got vaccinated. Some of us are really champions for that and proud to do it and prepared to do it. And but not everybody is, and not everybody's in a circle of maybe family and friends who would be supportive of that. So I wouldn't want to set you up for unpleasant experience and make you shoulder that burden.
And then, so how about for parents who are looking for more information? What are some resources you trust and you would like to direct parents to look for more information about the COVID-19 vaccine for adolescents?
So one place I like a lot, although sometimes I find it difficult to navigate, is the CDC website. cdc.gov has a lot of information on vaccination. For people who are looking for really specifics, very specific information, the Advisory Committee on Immunization Practices, or ACIP. If you just search for ACIP, you will find it. It's a subset of the CDC. Their presentations from the meeting, the PowerPoint slides from where this was approved, are all available on their website.
It's pretty technical though, isn't it?
If you really want the specifics, that's very technical, but some people are going to want to see that. So if that's what you want, the ACIP meeting information, you'll find it for the May 5th meeting. Otherwise, I'd say cdc.gov has less technical information. And then, as always, I would refer you to your trusted provider for healthcare, whoever that may be.
And if, for those of you watching, if it is Valley Children's, you can always go to our website as well, valleychildrens.org/COVID-19. That's valleychildrens.org/COVID-19. A reminder, we do have nurses who also operate a phone line, a COVID-19 hotline, and they will answer any and all your questions. And everybody at Valley Children's, including you, Dr. Dahl, are very used to answering 1,000,001 questions from worried parents. So I do know that the staff at Valley Children's, just like you are very willing to answer any and all questions that parents might have. So for those of you watching at home, do not hesitate to send us emails or write some comments. Again, there on your screen right now, you do see the website. And then the COVID-19 hotline is 888-286-9336. That's a toll-free number. If you live in the 559, you can just dial 353-3333. Again, we do have medical experts who are operating those phones. And if they don't happen to have the answer at the moment when you call, they will certainly help guide you to resources and to other people who do have that answer. Dr. Dahl, thank you again for your time. Anything else you want to share before we end this week's update, this month's update?
Just sort of what we started with, that children 12 to 15 deserve the protection of this vaccine. And COVID-19, even when it's a mild illness, is not one that anybody wants to have. I think your children deserve this, and I hope this has been helpful information and somewhat reassuring to you. And again, if you have lingering questions, talk to your provider.
Dr. Dahl, thank you so much. Those of you watching from home, from office, from the beach, wherever you are right now, thanks for tuning in. Have a good day. Stay safe.